Welcome to Functional Fridays. I am Sherry Jacobs, naturopathic doctor and certified nutrition specialist. I'm with Shannon Kennedy, internal medicine doctor. Today, we want to talk a little bit about food sensitivities because it's something we do often here in the practice. And so there's food sensitivities, there's food intolerances, and there's true food allergies. And so those terms get mixed up often. There's the food allergy, which is you eat a peanut, you can't breathe, you have some kind of immediate food reaction, and sometimes it can be life-threatening. Those are severe allergies. What we're talking about most of the time, most of the time people come in, they know about their severe allergies already, they've had them since childhood. So we started to talk about food sensitivities, which are lower level reactions. You can have, joint pain, you can have skin issues, you can have menstrual irregularities. Really, it depends on how your body's handling the food, how it's going to manifest for you. And then there are food intolerances. Food intolerances would be, more that you're missing some kind of enzyme in the body. You don't handle food groups like oxalates, or there's, a genetic issue related to sulfur metabolism, or things like that. So those are even a little bit different category. We always screen people for food sensitivities, those lower level types of reactions. And we think everybody should do a hypoallergenic elimination diet at some point in their life.
Right.
I think it's great for families because it's even good for kids to do. You're not limiting calories, you're not limiting huge food groups, you're just taking out inflammatory foods. And so if we can get families to do it together, I think everybody really benefits. It's a healthy diet. So we take out the 7 foods, which is gluten, dairy, corn, soy, egg, peanut, and sugar. And so, let's eat that sugar. And so you take those out, and then you reintroduce in a specific way to see how symptoms are resolved, and then how symptoms come back in. So I think everybody across the board should do that. And then at some point, probably everybody should be tested for food sensitivities as well. We run a finger prick in office to look for, we do a 96 food panel. That's a good thing to do because there's not 96 foods that you might think of eliminating from the diet, right? So, you've got your 7, and that takes care of most people's food reactions, and then there's people that still have these chronic symptoms, or they want to know more. And so the food sensitivity panels are a roadmap. They're not the be-all, end-all. There's certainly, some foods you can be reacting to, like I said, from an intolerance perspective or something like that. So yeah, I think it's part of, just something that part of overall care that people should do at some point, particularly if you have certain symptoms that might indicate a food reaction. But finding out what's right for your body, I think, is what we all want to figure out, and that's a piece of it.
Yes, definitely. From a conventional medicine standpoint, we're not trained at all to look for food sensitivities or food intolerances. So we'd say, well, if you have abdominal pain after eating, milk, don't drink milk. You probably have dairy intolerance, and then that's where we leave it. Don't do that. And it's hard for people to just change their diet based on being told don't do that. So sometimes just looking at it, and seeing it on paper, like wow,
that's my blood. That's my immune response.
And to dairy is helpful. And then, like you said, sometimes there are things on there that you would never think were bothering you, and you also may have thought, well, my joints just hurt in the morning, and that's just me. And an hour after I wake up, they're better, and so I just carry on, and you eliminate something that you didn't realize was bothering you, and you don't have joint pain, and so you feel better, you feel younger. Maybe you do more, exercise more, and you dive deeper into your wellness. So I really think food sensitivity panels can open up doors to wellness that you didn't even realize were closed. That being said, some people come back with just a ton of things on there that are positive. And then the idea that your gut is leaky and that there's a lot of stuff going on just with gut inflammation, and treating that can allow you to tolerate these foods more. So it doesn't mean that you have to eliminate all those foods for the rest of your life.
Yeah, if you do a 96 food panel and 50 foods show up high, we're not making a diet change at that point. That is gut integrity.
Right.
That's something's going on there with permeability, and that's the place to work, not eliminating those foods. But yeah, I think it's insightful and helpful. And speaking of the conventional perspective, is if you go, definitely if you go to your allergist or you go to your primary care doctor and you ask about food sensitivity testing, they're not going to test. It's not going to be covered by insurance. If anything, you'll get the typical IgE mediated response.
Right.
It's good information to know as well, but that's really not part of the conventional model.
Right. If you run all those foods for the conventional testing, they'll say you're not allergic to all these foods. You're like, of course I eat them and I don't anaphylax, so I'm not.
Right.
Obviously we knew that already, so it's not necessary, but it's really good information. information. The other thing that you brought up was the elimination diet, which I think is wonderful to do, but in recent times, I read an article about how elimination diets are just awful, and they're being over recommended, and people are doing them, and they just take many things out of your diet that are healthy and good. And we're not recommending being on an elimination diet for months and months and months.
Right.
But to once or twice a year, just eliminate these really inflammatory foods, or not necessarily inflammatory foods, but foods that you eat twice a day, every day. Eliminating them from your body for 3 weeks is actually a really good thing.
Yeah.
A treat is not a treat if you have it every day.
I've heard that.
Yeah. And so, a couple times a year, if you get rid of dairy, even if you don't feel like you have a reaction to dairy, is probably a good thing for your body. So I don't believe that elimination diets are bad. I don't think you should live on an elimination diet, but you eliminate foods.
No fun.
And then you add things back slowly, and you see what your body reacts to and how you feel, and that's amazing information to have. It also saves you money, because when you're on an elimination diet, you're not eating out. You're not eating a lot of things that you spend money on. And then you don't have to do, if you can't afford to do the food sensitivity testing because insurance doesn't cover them, you can get a lot of information from eliminating a food and then adding it back and seeing what your body does.
Yeah, that experiential component, even if you do a food sensitivity panel, doing the dietary part and the standard hypoallergenic diet is, it's good.
That's good. It's good practice. So, thank you.